My name is Tanji Kelshum. Um, and in this presentation, I will examine the role of Native Americans in movies and how they are portrayed, as well as how this affects the perceptions of society and healthcare. I will be examining three movies: Smoke Signals, Dances with Wolves, and The Lone Ranger. I will attempt to point out the improvement as well as the ongoing prejudices that still exist. The media is very influential in constructing the perception of minority and indigenous populations among people. Most Native Americans historically have been portrayed either as noble warriors, spiritual guides, or violent adversaries, simplistic archetypes that do not portray the rich, diverse culture that existed amongst Native Americans. These depictions do not only influence entertainment, but they also add to prejudice and misconceptions in real life, particularly when such previously mentioned fields as healthcare and education. Examining the ways in which media shape the cultural identity can assist nurses and other healthcare professionals to understand these prejudices and how they could play a role in their relationships with Native patients without their conscious awareness. Being nurses, media awareness implies that we ask questions about the images that we watch and how they shape our beliefs. This strategy will help us allow to offer equal, compassionate, and culturally competent care to every patient, stereotype free and based on respect towards their experience. The main objective of this project will be to explore the role that media representations of Native Americans play in the cultural perceptions and the attitude of the population. The goals of this would be to first determine the media patterns in the chosen movies. Secondly, to find out whether these depictions are consistent with actual cultural and historical experiences. Thirdly, to examine the potential impact of these portrayals on professional attitudes in healthcare. And lastly, to offer suggestions on how nurses can apply cultural competence to overcome these biases. These goals are based on the fact that health inequalities are not solely clinical, but also social and cultural. Constant exposure to biased images can support the presence of stereotypes that can influence patient care and communication. On the other hand, real life images create sympathy and compassion. The culture of Native Americans have hundreds of tribes, languages, and practices in the United States. International differences notwithstanding, there are some values which are common to most of the tribes, and they are spiritual harmony, nature, respect, community interdependent, and balance between mind, body, and spirit. The policies of colonization, forced relocation, and assimilation, including the system of the Indian boarding schools, ruined the native communities, destroyed their language, their land, and traditions. But Indigenous people have managed to maintain their resilience and identity through storytelling, through art, and cultural revival. In the case of the nurses, it is important to learn about this cultural richness as the health benefits and healing practices are closely related to these values. A lot of the Native Americans integrate Western medicine with traditional healing with the focus of harmony and balance rather than symptom treatment. This complexity is usually mistakenly portrayed in popular media in an oversimplified or in a mystical manner. So the first movie that I want to discuss would be Smoke Signals, that was released in 1998. It is one of the milestones in Native American films. It was written by Sherman Alexie. The director is Chris Eyre. That became the first feature written and directed and acted by Native Americans. The plot is about, I'm not sorry if I'm going to say this right, Coeur d'Alene men, Victor and Victor Joseph and Thomas builds the fire who embark on a journey by road to retrieve the ashes of Victor, whose father died. Contrary to the majority of Hollywood portrayals in Smoke Signals, there is a true modern native life full of humorous, painful, strong, and loving moments. It does not ascribe to the stereotypical tragic Indian and introduces native people as dimensional. To nurses, this film is a model of real depiction that facilitates enlightenment. It brings out such themes as intergenerational trauma, relationships within a family, and forgiveness, which are all pertinent to health and well being. In order to deliver effective care, it is crucial to recognize the impact of trauma on the health outcomes of Native people. Then we have Dances with Wolves that came out in 1990 by Kevin Costner, and it is a film that describes the relationship between a Union soldier with the Lakota Sioux during the Civil War. It was commended to present Native Americans as civilized and decent instead of barbaric killers depicted in previous movies. However, even the story revolves around a white protagonist who rediscovers and authenticates a native culture and supports the white savior narrative. Such a pattern represents a widespread trend of Western media. The native voices are seldom allowed to narrate themselves. This dynamic in nursing reflects the similarities in that healthcare system does not always understand the needs of the community and the external solutions that are imposed upon them. Cultural humility teaches us to listen and not to lead, to collaborate and not control. Although Dances with Wolves is a step in the right direction by humanizing Native characters, it remains the voice of colonialism. To medical practitioners, it serves as a way of reminding them that patients have the right to be themselves and to follow their customs. Serving to empathize is never paternalism. This next clip, um, The Lone Ranger. This was out in 2013, directed by Gore Verbinski and featuring Johnny Depp as Tonto, shows how even contemporary media could reproduce the absolute stereotypes. Even though the makers of the movie purported to celebrate the culture of the natives, the depiction of Tonto in this mystic, quirky character with painted face and slangy English speak of Hollywood tradition of caricature. Although the performance was intended to be respectful, it was heavily criticized as the cultural appropriation of the performance and non-authenticity as Johnny Depp portrayed. In the movie, Native identity has been diminished as a costume and comic relief instead of an experience. To healthcare practitioners, these depictions are a lesson. In cases where stereotypes prevail, they form unconscious beliefs about actual individuals. This can be manifested in nursing as communication, trust, and diagnosis bias. As an example, a provider may not underestimate the knowledge of a Native patient about his or her health situation, or they may not recognize cultural trauma as an important factor in treatment. To address these trends, nurses should overcome them by using cultural humility, learning on the voices of Indigenous people, and admiring the traditional viewpoint and understanding the damaging depiction aids in breaking the prejudice that the media has established. So, comparing the film interpretations with academic literature and real life statistics, we find that the media simplifies or distorts the Native American histories. The academic literature indicates that the Indigenous communities are resilient, they're strong in their culture and healing as a community. Nevertheless, popular cinema is more likely to represent them as morbid, supernatural, or ill fated and hardly consider modern life. Smoke Signals resonate most with the reality, where it is humorous and full of struggle, whereas The Lone Ranger has fantasy that is not attached to the truth. This disconnects between description of life and experience has an effect on the way the society, or in other words, healthcare workers perceive Native people. Such nurses who make their decisions based on stereotypes instead of knowledge can create prejudice or ignore some critical aspects of care accidentally. Through literature, we get a better understanding of the determinants of Indigenous health, including poverty and marginalization and historical trauma on a systemic level. The knowledge of these realities make nurses treat patients compassionately and precisely instead of what the media has informed them to think. Natives experience severe health inequality related to centuries of historical trauma, displacement, and social exclusion. The main health issues are diabetes, cardiovascular disease, substance abuse disorder, depression, and suicide. This is exacerbated by poverty, inadequate infrastructure and health, and geographic remoteness. In addition, the overall mistrust of Western healthcare system is heavily ingrained within many Native communities because of unethical practices of the past, like forced sterilization and medical neglect. Health beliefs may also be misunderstood or non-compliant to unless they are addressed with respect, given the cultural differences. What the media shows, which make these communities mere stereotypes like drunken Indians or noble victims, is part of the root cause of ill health, which is systemic. Nurses should go beyond myths in an attempt to identify the social factors behind these differences. It is important to build trust by being consistent, listening, and being culturally aware. The media does not only entertain, it forms the minds of people and policy. The images of Native Americans as helpless, mystical, or self-destructive depict them in a way that influences how the society distributes resources and compassion towards them. Policymakers could disregard Native American problems since they consider them to be cultural but not systemic. Healthcare providers may unwillingly embrace biases that affect the process of patient care based on the assumption of noncompliance or uneducation, where systemic barriers are actually present. Conversely, precise and enabling representations such as smoke signals can increase knowledge and sympathy towards these people. Media literacy is a professional skill of a nurse. The knowledge of the way representation shapes perceptions will aid us in practicing against bias. It also allows us to teach others and be the proponents of fair treatment. Nurses, being the leaders in healthcare, can foster authentic representation by engaging the community via outreach, educating about diverse cultures, and supporting the inclusion of diverse storytelling. Cultural sensitivity nursing is more than merely recognizing the differences, but is more proactive in examining how our own views have been influenced by society, by media, and the experience. Nurses should learn to establish self-awareness regarding prejudices that can affect the interactions with patients. Native American patients require trust building since historically, those patients are usually skeptical of healthcare facilities. This involves compassion and tolerance and dignity of the traditional healing methods, the open-ended questions, participation of the family, and integration of spirituality and care plans where needed are practical steps. Nurses are needed to be the agents of change by breaking the stereotypes, encouraging cultural awareness, and ensuring that the policies do not violate the autonomy of the Indigenous people. Cultural competence means being a humble person, acknowledging the fact that we are all lifelong learners. Nurses also develop effective relationship with patients by interacting with real cultural knowledge and disproving the myths created by the media. And in conclusion, this project, I believe, demonstrates the effects of the media representation on the cultural perception and healthcare attitudes, which are potent. We have also watched via smoke signals, Dances with Wolves, and The Lone Ranger, the continuum of expression between what's true, romanticized, and what's stereotypical. Not only do these images shape the perception of Native Americans by the masses, but they also affect how healthcare professionals engage with Indigenous patients. Among nurses, knowledge of these influences is the main factor to practicing cultural competence. Through a critical analysis of the media, we are able to discover and unlearn prejudices that may prevent fair care. Literature and lived experience give us a better understanding of the Native health challenges, including systemic inequities, mental health crises, and the long-term impacts of historical trauma. We are expected to listen, to learn, and to speak up in favor of respect, representation, and justice. Thank you.